Next, I'd like to welcome and introduce Shani Gwin. Shani is the founder and managing partner of pipikwan, pêhtâkwan, an Indigenous-owned agency focused on elevating Indigenous voices, projects, and issues. Shani has over 12 years of communication experience working for government, private and not-for-profit organizations. She's a sixth-generation Métis woman, a member of the Cunningham clan on her mother's side, and a descendant of the Michael First Nation and Ferguson clan on her father's side. Shani was an Edify magazine's top 40 under 40 winner and has established a reputation for building capacity in others and creating transformational change. I've had the opportunity to see that she leads with love, kindness, integrity, and humility. We welcome you, Shani.
Tanse, hello. Oh my gosh, I can actually see over this podium. What a relief. I usually bring like a little folding stool with me, just in case. Well, I'm honored to be here on Anishinaabe and Algonquin territory. As Suzanne mentioned, I'm a sixth-generation Métis person, and I currently reside in Treaty 6 territory, Region 4 for the Métis Nation, and Miskwachi-Waskagegan, which is also known as Edmonton, Alberta. With the government, as Suzanne mentioned, I have Métis and First Nations heritage, but I can only check one box. So I do have a Métis card, but I always honor my First Nations heritage, which I'm a descendant of Michelle First Nation. I was enfranchised by the Indian agent of the time in the 50s, and most of us don't have status anymore, but it sounds like that might change soon, so that's exciting. Before I begin, I would love to just share that I am a mom. My daughter Quinn is right here. She came with me to watch. What a big, I'm really nervous just because she's here. I also have my son Charlie. He's 4, turning 5, and a very rambunctious little guy. And I'm also a proud partner to my husband, Trevor. I want to also acknowledge my mom, Corolla Cunningham, my dad, Lloyd Gwin, my nookum, Florence Ferguson, my papa, Chester Cunningham, and elders Vicky Whalen, Peter O'Cheese, Tony Alexis, Laurette Goulet, Roxanne Tassusis, Joe P. Cardinal, and Teresa Strawberry. And I do that because what I'm going to share has been heavily influenced and taught to me by all of those people throughout my life. Those are my PhDs, and they teach me so much. I work primarily in communications. I use my lived experience as an Indigenous person to bring my lens to crisis communications, issues management, marketing campaigns, anything to do with communicating, we will do it. And we also have an engagement firm where we bring our relationships with Indigenous community members to organizations to help them do meaningful work. I was at a keynote not that long ago, and it was about decolonizing media. And afterwards, one of the publishers came up to me and she says, "What do you think about the neutral voice in media?" And I was like, wow, I never thought about the neutral voice. And so for those of you who aren't aware, journalists have to write both sides of the story, essentially, but they have to do it with a neutral tone. So they're not supposed to take a side. But what we were talking about was who is the neutral voice? Because it has to be someone deciding what the neutral voice is. it won't take you long to think about who is in newsrooms. Who are the journalists? Who are the editors? Who are the publishers? Majority of folks in newsrooms are white, and so they're part of the dominant culture or population. What is neutral for them isn't always perceived as neutral by Indigenous peoples or other communities who are usually defined as marginalized. And marginalized is used because that's how we are treated. Our perception of reality, it's not seen as significant. It can be considered wrong, or it's excused as only applying to a very small portion of the population. So therefore, it cannot apply to all. When you have a bias you might not be aware of, you're more enlightened in a specific topic or culture, it's going to impact the way that you write. It just will. So neutral, there is no neutral. It's defined by the writer, the editor, and the publisher. So you're all like, okay, we're at a health conference. Don't really know why we're talking about news media. But when I started working with CADTH, we would hear a lot about the pan-Canadian approach to health. And it reminded me of the term pan-Indigenous, which is a term that Indigenous people use when we feel groups are lumping all of us into one. So in First Nations, Métis, Inuit, those are your three main groups. But within each of those, you have thousands of communities that exist and have different perspectives or different ways of knowing and doing that are just important to acknowledge. Just because Shani, the Métis person that spoke to you today, has a certain perspective, that doesn't mean it will be shared by the Haudenosaunee or by the Stoney people. So we are not a homogenous people, and I think we know that Canadians are not either. Not long ago, we were asked to facilitate conversations with staff, and they could ask me anything they wanted, specific to health or not, about Indigenous people, and this really made for some interesting conversations. What I thought was especially interesting was when folks who had more melanin would ask me, how do Indigenous people approach health? And so I would turn that question back around and say, well, how do you approach health? And I would get an answer something like, well, I approach health just like everybody else, I go to the hospital, and I get prescribed medication. I use the Western medical system. I was like, oh, okay. How about your parents? And then their face kind of changes. Well, yeah, they have a bit of a different approach. They do use the Western healthcare system, but they also use, and then I started hearing about all these ancient practices. And a lot of these ancient practices I thought were interesting because they would always add, which we now know, someone was telling me about a spice that they used for an antibacterial. And she was like, and now it's proven that that is an actual antibacterial substance and that we can use it. So there's lots of things from these perspectives of people that are probably already in your circles, in your organizations, that have different perspectives of health. When I asked them, I was like, did they pass those on to you as a child, or do you use any of those methodologies or treatments now? The answer was yes. And so that worried me, was that when I first asked the question, their response was to say what they thought I needed to hear based on how they show up for work, which means they're turning off their perspective and their lived experience as a person of color, as someone from a different culture, from a different marginalized community. They're not bringing that perspective to work. It seemed like a lot of people, and I wouldn't say it's just from an organization, didn't feel safe to bring that forward. And I think we should have a pretty good idea about why that might be. Throughout the years, newcomers and Indigenous people have just been asked to assimilate, fit in, don't cause problems. In Canada, people of different backgrounds, ethnicities, or identities of any kind who work here are often turning off their true selves to be accepted and included. To be welcomed in and not isolated by their peers for thinking or doing things differently. I don't know how many people packed a bit of a different lunch in school and someone had something to say about what was in your lunch. Me, I had that happen to me a lot. So there's just little microaggressions throughout the years that happen. People make comments about, why do you have this, or what is that, or ew, that eventually you just start to keep those things close to your chest. For folks outside of the dominant culture, this means you could be labeled as difficult, emotional, rude, too quiet or reserved, unintelligent, or maybe even weird. And when you challenge something, it could also mean risking your livelihood. So I'm here to remind you to include is just not enough. We have to make it safe for folks to share, to challenge, to innovate, which is really to decolonize. When we bring people in and they can share how a system is harming them and their community, this allows us to shift the system, to make positive change for all. We have first-generation immigrants coming to Canada. It's happening. Lots of newcomers. And how often do you meet an engineer or a doctor or a lawyer who is working in the service industry because they're unable to move their credentials over? So we ask these folks who left their country for a better life here to just go back to the drawing board. You have to get your Canadian education and experience, and we dismiss them until they can succeed and prove they can do what we need. And we hear a lot of misinformation about why this is. Someone told me just last week that they had heard, well, granted, I live in Alberta, so we'll just put that out there. I heard just last week in Alberta that this woman had found on the internet that in a certain country that I won't name, they reuse needles willy-nilly and don't sanitize them. And so immigrants that come here, that they're gonna do that and we're all gonna die. I was like, whoa, what? Not to mention, before she said it, she said, not to be devil's advocate, which is usually my cue that you're gonna say something really racist. So, just so you know, if you say that to me, I'm gonna be like, ding, I'm gonna hear something weird. So, I also have heard that they don't understand how things are done here. But where I get troubled is I tell a lot of people, I come to a lot of things that I don't understand, like my 5-year-old son, Charlie. So I think about this and I go, okay, a lot of these people are coming from colonized countries, likely a British colonized country, under a British education system. So they can't be that far off. And you know, sometimes things are done differently and it's okay. It's okay if it doesn't fit your idea of normal. We can get a little uncomfortable with new to you and stop letting our fear hold us back. Newcomers live by the rules and laws imposed by governments here. Why would they not live by the guidelines and expectations of the healthcare system when granted access to treating patients? There must be an easier way to get them up to speed with what we do here. We know what it does, though, by keeping them out. We impose a class system that keeps the dominant culture and population at the top, in power and control. The decision makers in power and control. And it forces marginalization and eventual assimilation of our new community members. With a healthcare system that much too often fails to meet the needs of folks outside of the dominant population, it seems like a big mistake. I feel we are missing a major opportunity for innovation and moving to a healthcare system that treats people first rather than just their symptoms. In my culture, probably a lot of folks, I think, may have heard about a medicine wheel. And so when we go to see elders or medicine women, we are treated as a whole. That circle has to be completely round in order for us to be healthy. And so we're not just looking at my physical health, we're looking at my mental health, my emotional well-being, mental, physical, emotional, spiritual. We're looking at all of those aspects to see where I'm at. This also applies to Indigenous people in terms of letting people in. Indigenous people who are here now and always have been, our elders, our knowledge keepers, they hold PhDs in our communities. Our PhDs we've granted to them. They're not a Western PhD. They know a lot about Canadian health, this land known as Canada. I believe that all historical accounts, both Indigenous and European, track that we helped folks survive on this land. And not just the harsh elements, but also treating illnesses and symptoms. We even taught Europeans how to bathe. Yeah, that's what we did. So I just wanted to sink that in because I believe proper hygiene is one of the most important aspects of health. And that was brought to the attention of Europeans by Indigenous people living in Canada at the time. The illnesses that came with Europeans, we didn't know how to treat. So in Treaty 6, there is a medicine chest clause. And what that does is it gave us access to Western medicine that we didn't have. We didn't know how to treat these new illnesses that were coming in. And so the medicine chest clause was something that was supposed to give us access. We are still fighting over the medicine chest clause, for those of you who don't know. I read a lot, and lately I've kind of been into reading science journals and publications, which maybe that come as a shock to some people. But something that I find really interesting is how the science community is really catching up to the teachings that I've known my whole life. So they're now being proven by science. How to take care of the land, what is the universe, how did we get here, how do we live in harmony, how do we take care of ourselves. Science is now meeting us in the middle. They don't know that, but I know that when I'm reading the articles. And I mean, usually that's how this kind of thing works. Indigenous people aren't validated unless they're validated by a system. So for treaty, you will see, well, my whole life I've heard how annoying it is, how often Indigenous people are in court looking for something, looking for money. Well, what people might not know is that our rights that are written in treaty, a lot of them were just completely ignored. And so we have to challenge those rights in court, otherwise they do not exist to the provincial government or the federal government. They will do their best to honor them, but to set them as our actual right, it's not happening. And for an example would be the Sovereignty Act that got announced in Alberta last fall. You could take a look at that and see what some of the chiefs were saying about treaty being ignored and our boundaries and our rights. So, where am I? So science is slowly validating us, and maybe not in court, but they are writing research papers that align with my values and the things that I've been taught in my culture. Indigenous people, much like other cultures living in Canada, are both an ancient and a modern people. You'll often hear living in two worlds. I'm pretty sure that can also be applied to Black, Asian, LGBTQ2S+, and other communities, that we live in two worlds, our world and your world. We have a lot of solutions to your problems. The same problems you keep banging your head against the wall, trying to figure us out. For Indigenous people, the systems have been really trying to figure us out, what we need, how to fix us. Often we have folks with a lot of money deciding what we need for us. I'm going to change just a couple elements of the story, but this is a real story. A very wealthy man visited a First Nation near where I live, and he called us up. He was all excited. He says, I want to get this nation an indoor swimming pool. I'm donating an indoor swimming pool to this nation. I was like, oh my God, that's amazing. How did you know that they needed one? Well, I don't know if they need one, but they don't have one. And I was like, oh, okay. Well, that's a lot of money to just go into a community and say, this is what we're building. You know, First Nations communities, that might not be a priority for them. They might be able to use that money for youth programming or infrastructure or repairs. You know, there's all sorts of things that they might be able to use with that large sum of money. And so he hadn't engaged them, and he just wanted to continue on the path of, I know what's best. But we can't do that. We have to listen to each other, otherwise we won't know. It'll be our own assumptions. The thing is, Indigenous communities within Canada, we know what we need. We know how to treat our symptoms so that we can be whole. We know how to lead from a people-first approach. Often those approaches are looked at as insignificant or ooga booga, like spook. What are they talking about? Why are they lighting that thing on fire? I keep losing my spot. So natural treatments and believing in your body as a natural healer doesn't always align with the healthcare system or a pan-Canadian approach. People are listening to us. We haven't been wrong yet. We weren't wrong about the children's graves on residential school sites. We weren't wrong about how to care for the water and the earth. And we aren't wrong about how to keep our children out of care, and that's just changing now, that we will be able to bring children home to our communities and support them in our way of knowing and doing. So why not give us a chance with health? If we take a pan-Canadian approach to health, what does that really mean? Think about that neutral voice in journalism. Whose voice is that? For a pan-Canadian approach to health, we need to know who is informing it, who is deciding, who is implementing it. Is it what Canadians truly need? Is it harming others? If it is the patriarchal and colonial systems continuing to decide, keeping other important and ancient perspectives out by imposing and forcing a perspective upon the rest of us, it won't work for everyone, or even the majority. There's nothing for us without us. I think maybe you've heard that before. The harm will continue with the bias imposed on the system, and not just harm, but death in some cases. If we don't look at the inclusion of different perspectives, listening to those perspectives, understanding those perspectives, and working together to make change, you're going to just keep banging your head against the wall, and why you can't figure it out without us. Thank you so much. Hi, hi.